17-year-old Lariah Stewart is a sprinter who's been temporarily sidelined by chronic knee problems.
Ever since middle school, 6th grade, my patella popped out of its socket.
She'd seen several doctors and tried dozens of leg braces. Eventually, she came to Shriners Hospitals for Children, where they've just launched a sports medicine practice for kids. Doctors here discovered that the problem with Lariah's knee actually originated with her hip, and that she needed surgery to correct the problem. You had seen other doctors at other places and other specialists about your problem before.
None of them ever mentioned a hip rotation surgery being like the answer to it.
You have to treat them completely differently. Kids are not small adults.
Dr. Michael Priola says there's a need for this type of specialty. He says too often sports medicine specialists are only geared for adult patients. But kids' bodies and their injuries don't follow the same rules because they're still growing.
Say a 10-year-old sustains an ACL injury, you can't treat it the same way as an adult because the growth plates are open, so it's a completely different surgery. Same with ankle fractures, same with shoulder injuries.
Right now, they're seeing about 2 to 3 sports-related injuries here a week. They expect that number to grow. And in case you're wondering, the most common injuries are knee tears and ACL tears. Today, Lariah is finally on the track to recovery. And after 2 more weeks of physical therapy, she'll be back on the real thing.
I want to see if I'm going to be slower or faster or the same. And I don't know, about track, it's just the adrenaline.
In Minneapolis, Ellen Gallus, 5 Eyewitness News.